Maimonides is a 705-bed medical center. It has 6,200 employees. It is one of the largest independent teaching facilities in the country. We have over 400 residents within the medical center itself. And then there's another almost 1,000 voluntary physicians that participate in services at Maimonides. Maimonides' mission is to provide the best health care possible to the community. It's a large hospital with a very diverse population. We also deliver the most babies in the state of New York as a single entity. We're tracking close to 8,000 babies this year. And we also provide the services for the largest geriatric population over the age of 85 within the state of New York. As a medical center, the needs are the growing population, the diversity of the population, but the cutbacks within healthcare are tremendous. We serve over 82% Medicare and Medicaid population, and as the federal government moves forward with their initiatives, we see a lot of cutbacks. So providing the same services, more with less, as everybody is in today's world, is a challenge. Patient safety and confidentiality is of the utmost as security. So we try to ensure that patient information is there, it's secure, and it's safe, so that when people have the information and it's put on a computer, they don't have to worry about breaches, and they can be confident that their personal information is not going to leak through any other sources. Our mainframe data center is in New Jersey, so we have communications going from New Jersey throughout Brooklyn, throughout New York City. We support over 25 different locations throughout the borough of Brooklyn. So we've automated our OR systems. We've put supply chain in place so we can have automatic replenishment of supplies for the ORs. We also are currently putting together an integration plan for the anesthesia department, where all the monitoring of equipment is actually going into service and will electronically flow into the patient records. We found that being able to mobilize the workforce with handheld devices and computers on wheels, things like that, help to make the workforce a little more accurate with their things. Things get done a little bit more timely. So if a patient needs to have orders done, they can have a computer by the bedside. A physician on grand rounds can have a computer right by the bedside. He can order medication, he can look at lab results, he can pull up an image. He's able to do a lot of different things that other hospitals don't provide. The Brooklyn Health Information Exchange is a program that Maimonides was the applicant stakeholder for. We were actually granted $4 million from the state of New York to build a regional health information exchange. With that, we're looking and focused more on the continuum of care and the transition of care. As I said earlier, we have one of the aged populations in the country, and they require a lot of care. When patients transfer from home care to a hospital, there's little documentation. When they go from the hospital either to a long-term care facility or back into home care, it gives us the ability to have the demographic information, the medical history, some of the key findings that patients have as far as what the patient's problems were. It gives the transition of care as far as medicine, laboratory results, and it's diverse throughout the continuum. So we've partnered with several hospitals, home care agencies, and long-term care facilities to share that information from one common system. We take the information from the physicians and we send it into this care engine, and it goes through some decision support cycles. It's like a business intelligence, only it's from a clinical perspective. That in turn messages the physician that he's on the right track in diagnosing the patient, or maybe he should look someplace else and some other ways to resolve some of the patient's issues. Maimonides' strategic plan for the next 5 years is going to be changing dramatically. As the federal government has started many initiatives, they're looking at more of an ambulatory proactive care management. They're looking at medical homes, looking to keep people out of hospitals, out of long-term care facilities. But you still need to be able to monitor the patient at home, be able to communicate with the patient at home. And I see that as a great growth opportunity both for Verizon and for Maimonides as we go forward. Maimonides chose Verizon as a partner to work with them because they have the communications capability and scalability that's required for the medical center as it grows. An ideal partnership is working together. It's not just somebody coming in and selling you something. That's a vendor. Partnerships are when you can depend on somebody that's there when you need them, you have the continuity of information and consistently helping you through your processes and able to meet your needs.